Ready. Right. Very good. Good morning. As always, I generally thank our interpreters, Jay and Vicky, but today we've got Sarah, who happens to be Jay's girlfriend. Hope you don't mind me saying that. And so I look more normal sized today. So I'm very grateful for Sarah being here. Thank you so much. I will tell Jay we missed him. So we are going to, as always, start with the numbers related to COVID-19 cases in Hamilton County. So the number of positive cases in Hamilton County stands at 3,316. There have been 628 hospitalizations and 181 deaths in Hamilton County. Today we are going to get an update on those numbers from interim county Health Commissioner Greg Casterman. Greg's also going to talk about some of the openings, and he's got a variety of things that he's going to share. And then we're also going to talk about another health crisis in our community that is ongoing, and that is the health crisis of drug overdoses in Hamilton County. So as many of you know, I'm the chair of the Hamilton County Addiction Response Coalition, and I'm joined by Tom Sinan, who is the co-chair of the Interdiction Committee. And we are going to run through some of what we're seeing in Hamilton County related to overdoses. It's concerning, to say the least, because we are seeing an increase in overdoses, significant increase. And so we're going to kind of run through that. First, I've got a couple other kind of housekeeping items. So I've been asked a number of times when the building, the county administration building, is going to open. And so we, as you know, renamed the building the Todd B. Portune Center for County Government, otherwise known as the Todd. And so the building is going to open on June 22nd. It's a soft opening because people are going to be paying their taxes to the treasurer's office, the property taxes. And so some people like to come in and interact with folks from the treasurer's office and get a receipt. And so we are going to open up the building for that purpose on June 22nd. The entire building will be open to the public on July 6th. That is a change. And then our meetings, which we are holding virtually, we're going to continue to do that until further notice because it's very difficult to socially distance in that room in our chambers. It's a pretty small room. And so we will update as far as when we will go in person with our meetings, but we're not quite there yet. We have some good news. We issued a statement yesterday related to the CARES Act funding. So as you know, these are the dollars that came down from the federal government to be used for COVID-19 response in Hamilton County. We set aside $30 million for help to local governments, all 49 jurisdictions in Hamilton County. So yesterday, $25 million of that went to the local jurisdictions. It was allocated by way of the local government fund formula. That's the same formula the state used when they allocated their CARES Act funding to local jurisdictions as well. And so we do have a list of that breakdown, but it is an example of the partnership between the county and all 49 jurisdictions because these jurisdictions too are seeing a reduction in revenue and an increase in costs related to COVID-19. So we were very pleased to be able to do that. We did want to wait until the state made their allocation so that we could kind of do some gap funding there. And so that's exactly what we've done. So that money will be going out to those local jurisdictions within the next couple of weeks. So eligible funds, and the jurisdictions know this, can be used on PPE, disinfecting of public areas, payroll expenses related to public safety, and a couple of other things. All right, so next I'm going to provide some context for a health bulletin that we have issued related to the overdose crisis in our community. Daily Hamilton County overdose surveillance since June 9th has indicated some dramatic increases. So we have a slide related to this. It's a bar chart. And so let me know when you've got that up. Okay, so as you can see, this is from May 19 to May of 19 to May of 2020. So this is a year's worth of data. The blue indicates the total 911 responses. The red is emergency department visits, and the green is the death number. So as you can see, we had a high number, relatively high number, May, June, and July of last year, and then we have a pretty dramatic drop and a trend down. And so we were doing fairly well in the beginning of this year, but as things have started to reopen, we have seen a significant increase. And what you can't see here for April, May, and what we know in June is the death count. Those data points lag, and so they are not on here. But for May, the number of deaths, and you can see how high the number of 911 calls and ED visits were, the number of deaths is also higher than what we were seeing. It's suspected deaths are 42 for May. And in June, now remember, we're on June 17th, so we're midway through the month, we've already seen 32 suspected deaths related to overdose in June. These are dramatically high numbers. These are death numbers. People who overdosed and died in this community. And so we issued an alert, which is what we do as the coalition, to make sure the community is aware that this is what we're seeing. It's helpful for emergency responders. It's helpful for family of people who are in recovery, and it's helpful for the users themselves. And I'm going to let Tom sign and go into a little bit of detail related to that. As Tom's going to say, why are we seeing this? I'm going to let him expound a little bit on why we see those kinds of increased numbers. We think some of it's related to the drug supply and fentanyl being mixed into a variety of drugs. We also think that some folks, with the stressors of COVID-19 and the isolation of being at home, has limited their in-person contact with treatment providers. And so while treatment providers are still up and running and providing services, some of those services are virtual. And so they are getting back up to speed as quickly as possible for the in-person, but there was a little bit of a drop-off there for folks that are in treatment. And the other one, we were hearing that folks were reticent to go to hospital EDs because they felt like that was unsafe if they had overdosed. That is a connector to treatment, and so some of that had fallen off as well. So there are a multitude of issues going on here. So anyway, we issued this release. It is an alert to the community related to what we are seeing. Could you bring up the second slide? Because I just want to provide a little bit more context related to what we know. So the second slide talks about demographics. And so as you can see, the blue is the pie chart on my left, I guess it's on your left too, is the male-female breakdown. And so the blue is male, the red is female. And then the one next to it on the right talks about racial demographics. And so 81% white, 10% non-Hispanic Black, and 9% Hispanic. So while those don't look like very high numbers, they are a significant increase in communities of color. And so we are trying to pay attention to that as a coalition and messaging out, particularly to those communities, to make sure they know what we are seeing. Because as I said, this fentanyl is being mixed not only into heroin, but also into cocaine, also into meth, and so it is broadly affecting this community. So lastly, I've got a map. It's the last slide. This map is a map of the zip codes of drug overdose deaths in our community. So I think what this map says is that this issue is an issue for the entire county. We have some concentrations of deaths, but as you look at that, you can see that this is an issue countywide. So we have provided this a number of times in the past through the Addiction Recovery or Response Coalition, but I thought it might be helpful information for this moment in time. So I'm not going to go on any further. Tom Simon is here. He will be talking about this. But before we get to Tom, we're going to talk to Greg Casterman about the COVID-19 related information that he has.
Thank you, Commissioner, and good morning. Before I get into the data, I wanted to take a moment and thank Dr. Acton, the former director of the Ohio Department of Health, for her service. She led with empathy, compassion, and kindness during the most difficult public health challenge of our lifetimes, and it's greatly appreciated. Governor DeWine, a couple days ago, said not all heroes wear capes, some wear white coats, and that's true for Dr. Acton. We know Lance Himes, the acting director, very well here in Hamilton County, and I look forward to continuing to work with him throughout this pandemic and other items. Commissioner Dreihaus just shared Hamilton County cases. I always like to include the number of those recovered. So within Hamilton County's jurisdiction outside the city of Cincinnati, Norwood, and Springdale, there have been 1,797 cases, of which 776 have recovered. I'll touch on the reproductive value, something I've now been doing for a few weeks here on this press conference. There's a slide that shows Hamilton County's reproductive number, and for those of you who are not familiar with this number, if the reproductive value is greater than 1, we continue to see spread of an outbreak, and the outbreak will continue to cause issues for the community. When it goes below 1, the outbreak is slowly dying. If you could go on the second slide there. Perfect. So right now in Hamilton County, our reproductive number is 1.45. And for the region, it's 1.10. So we are on an upward trend. I'll get into a little bit more data here in a moment. I did want to talk about a slight difference. If you briefings, he is showing that the reproductive number for the Southwest region is 1.0. And I just shared this Southwest region that I'm sharing is 1.10. Our region includes 14 counties, including some in northern Kentucky as well as Indiana. So our region, because we're all so connected, is a little bit bigger when we're looking at the data. So we are going to continue to watch that. We also know that with increased testing, this is something I've been saying for quite a while, we will find more COVID-19. If you could go to the slide, the blue slide with the hospitalizations. So the number that we're really being cautious, or the data points that we're really watching closely right now, deals with hospitalizations, deaths, as well as intensive care unit admissions. And those have been hopping around but continuing to stay below the benchmark. And that's a good thing. That means we're doing a good job of controlling COVID when people do get sick. We now are seeing more young people with COVID tests coming back positive. And we know COVID is not as deadly for the younger generations as it is for the elderly. So I think these things are really important to continue to watch. I also want to emphasize, through our hard work and our willingness to follow the stay-at-home order, we've been extremely successful at increasing the personal protective equipment needed to keep our frontline workers safe. Should we see cases, these responders can now be protected while they take care of us. This is something they did not have the luxury of in March and April. So we've done a great job of making sure we have the necessary resources. I'll move on to the testing slide if you could. I shared last week, and I just want to keep emphasizing this resource. We have a map on our website, hcph.org, that shows testing locations throughout Hamilton County, and locations that are close to the county as well are included on this map. It shows where you can get tested, what you need, if you need a doctor's note to get a test, hours of operation, and phone number. So please use this as a resource. We were notified on the last slide there that the Ohio Department of Health is doing some free testing or no-cost testing here in Hamilton County. The location in the city of Cincinnati has hours on June 18th through the 25th. And I would encourage anyone who's looking to get tested, this is a great opportunity. So I will close in just reminding people that social distancing is critical for controlling the spread of COVID-19. If we are out and about, please be considerate of others and wear those face masks. And lastly, don't forget the importance of hand washing. If you don't have access to a hand sink, use sanitizer. And these steps will help prevent the spread of COVID-19. Thank you.
Thanks, Greg. One thing I neglected to mention when I was giving the numbers, I usually talk about the delta between last week and this week. It's the change, or rather the increase for positive cases, hospitalizations, and deaths. And so I'm going to give you those numbers too. So for those who have tested positive, the change in a week's time is 398. For those hospitalized, it's 33. And for the deaths, it's 8. Just wanted to include those numbers. I generally do that. All right, we are now going to go to Tom Sinan. He's the chief of police in Newtown, and he's going to expound upon the addiction issue that's happening in Hamilton County.
Good morning, everybody. Thank you, Commissioner Dreihaus, for having me. I want to kind of run into the why, what we're anticipating going into the summer, talk a little bit about alerts, and then kind of our messaging, what we're hoping to get across. First of all, the why, like Commissioner Dreihaus was talking about. When COVID-19 hit, we knew that there was going to be some issues with this. Luckily, we built some relationships not only locally but nationally and followed trends that not only go across the United States but across the world. With COVID-19 originating in Wuhan, China, we knew that China was one of the largest producers of fentanyl analogs along with methamphetamine precursors. There's been some progress made by the administration in trying to curtail some of that with China. However, it is still a major player in fentanyl. With the COVID-19 restrictions stay-at-home order, the coalition decided to start meeting, the steering committee decided to start meeting every week. We knew that the stay-at-home orders would have its own issue. We knew that the fentanyl supply would be disrupted, not go away. None of the drugs go away. They always have this ebb and flow. It was still here, but we knew that that trafficking supply would be disrupted. Those were major concerns for us because we knew on the back end, when that fentanyl supply opened up, that people's tolerances, those chronic opiate users, their tolerances would be lower. And we knew that there would probably be a push to get fentanyl on the street and be put in other drugs, and people that are recreational users, crack cocaine users, first-time users would have zero tolerance, which would cause more issues. What you can never predict on the back end, no matter what trends, data we have, what you can't predict is the damage. And unfortunately, we're seeing significant damage. As Commissioner Dreihaus said, with the 42 deaths coming in now with 32, there was one day last week where there was 20 reported overdoses in a single day. And I have to say that this was reminiscent for me of 2016 and 2017 when we first saw car fentanyl hit the supply in a stable, stable direction with fentanyl being in there. I was actually getting calls just like in 2016 and 17 from Cincinnati police officers and techs saying, hey, we're seeing a large number of overdoses. They had people crash in their car from overdosing. The number of 20 in that one day was very reminiscent of that. And that was disheartening because there are a lot of people who work on this every day and have been doing it for a long time, some decades, to try to make a difference. So it was disheartening to see this trend go that way. But we anticipated it, knowing that COVID would enhance this issue. The coalition worked on Narcan to make sure there's plenty of supply in Narcan. So where are we going in the future, and what are we kind of predicting, what are we kind of guessing for the future? We know based off the trends and the data that we have now, the public health has been a tremendous partner keeping those daily overdose tracks. The coroner's office has been a tremendous partner. We know that summer has traditionally been an uptick in overdoses. So you're going into the summer, that is traditionally an uptick. You're loosening the restrictions from COVID-19, and now you're having the fentanyl supply get back up to where it was before, which is kind of this, unfortunately, a perfect storm. So I am kind of analyzing that for the next month or two, we will see these really high numbers, sometimes these really big jumps and spikes. Unfortunately, these overdose deaths, there are a couple factors that could mitigate that. One is if the user that uses crack cocaine, powder cocaine, methamphetamine, the first-time user, that recreational user, if they follow the harm reduction techniques of using Narcan, you have to call 911 afterwards. Make sure that you're using CPR and also breathing techniques if someone's not breathing, and then get them connected to treatment or to the hospital at least. That would make a big difference. And unfortunately, the other way that this comes down, and this is not what we want, our goal is to have 0 people using drugs. We want 100% in active recovery. But unfortunately, another way this comes down is if those strong chronic opiate users, their tolerances are built up, we will see a lower overdose, and that's not what we want. We want them to be able to not use, but if that happens, we'll see that kind of go down. I want to touch base real quick on the alerts because there's some confusion about the alerts. There's a couple ways these go out. One is from the public health department, who has an internal system that it's triggered based off the stats. and the other one, which the last two, has been generated from the steering committee of the coalition. We're very fortunate again to have great relationships with public health, with the coalition. There's about 40 different agencies, probably about 100 different people in the coalition. The Office of National Drug Control Policy is a strong partner. So we're able to get national, worldwide trends along with local trends and follow that. What we do is when we see something abnormal, we talk about it within the steering committee. And one of the things with the steering committee is that there's never been a time I can remember where someone said, don't put out an alert. It has been that if we have this information, we should give it to the public, and that's generally what we do. The other thing that I'm going to say is, especially with fentanyl coming back and being mixed with all these other drugs, when I was growing up, people used to tell me, don't use drugs because the first time you use, you could die. I think back then, although there was cases and it was probably somewhat true, that was more of a scare tactic. We are telling you right now, today, that is not a scare tactic. It is 100% fact. The first time you use, or if you're a long-time user, you could literally die because of fentanyl and carfentanil in the drug supply. It is important that people hear that. And when we talk about these techniques of harm reduction, we'll get pushback and people will say, well, wait a minute, you're enabling drug users to continue to use drugs. I will push back and say what we're enabling is people to stay alive. And we have to rethink what our idea of the, and I don't use this word, I'll use the word that you hear in the public a lot, the quote-unquote addict is. You have to remember, this is someone's mother, father, brother, sister, son, or daughter. You have to think that that first-time user could be that high school kid, that college kid, could be that professional, that young person. And that's one of the trends we were seeing. It was so concerning that the coroner did a press conference last week and was so worried about this. So that first-time user is very susceptible. I want to also thank a lot of people. One is the first responders on the street in the county. The police and fire have done a tremendous job. I want to thank the coroner for speaking up about this and expressing the concerns that helped issue this alert. The steering committee, along with public health and along with the coalition. But I also want to thank the media. I've seen a transition from when we first started this, from this just being reported to now active members of getting information out. I can tell you the last two alerts, every time the alert went out, there was information on how to get treatment, how to use Narcan, and where to get help. So thank you for putting that out there. And I just want to end with this one kind of thought and kind of humanize this a little bit. We talk about 42 deaths, we talk about 32 deaths. Those again are people. We cannot discount the one because there's always a family attached to that. And you can think about that one person, and that death is hard. But what's hard on everybody else is that not only do we know people, but that family will forever grieve the loss of that person. They will always ask why. They will always feel that guilt. So this is personal for us. It never leaves us that we realize this is someone's loved one. And that's why we work so hard on this. So if we're going to take backlash for enabling, I think all of us have broad shoulders and say we'll do it, because our ultimate goal is to save lives. And that's why we put these alerts out. That's the messaging. That's why we meet every week, every 2 weeks, every month. We're doing this because we want to save lives. Thank you.
Thank you, Tom. So Tom just mentioned something that I want to circle back to. So if there are people listening who are family members or folks that are struggling with addiction, there is a helpline. I'm going to give you the number. It is 513-281-7880. Please, it's 24/7. Call that hotline. They will help. They will connect you to appropriate treatment, no matter who you are, no matter what you're using, no matter how old you are, they will help you. So please call 513-281-7880. So, and anecdotally, I want to say I live up in the Clifton area, and you know it's a bad day when you hear those sirens, because, you know, all the hospitals are up there, and we are just hearing sirens nonstop up in our neighborhood, and you know it's related to these overdoses. So it's just, it's sad, because as Tom said, I mean, I too get some of those phone calls from friends and family members who are devastated by the loss of a loved one. And so we just need to keep up the messaging. We need to keep up these alerts. We need to make sure the community knows how to get help and how to save someone who is trying hard to come out of addiction, but sometimes is still using something that's laced with fentanyl. All right, Bridget, I believe we are ready for questions.
Yeah, thanks. The first question is from Scott Wortman with the Inquirer.
Good morning, Scott.
On contact tracing. Good morning. So as testing ramps up, I'm curious, how are you guys, do you have enough, are you overwhelmed with contact tracing? How has that evolved as there are more tests?
So within our jurisdiction, we're still seeing between 20 and 40 new cases per day, and we are utilizing contract employees to do that contact tracing. At this point, we are not seeing any numbers of contact tracing that's overwhelming our team. We kind of have a plan set up so that our teams are with a team lead and 5 contact tracers under them. So if we get to a point where we need to increase capacity, we'll just bring on another team. We have kind of a pool of people that we're able to utilize. The other great tool that we have is, early on in this pandemic, we utilized a bunch of our staff members to help do the contact tracing. I have pulled them all off and they're back doing their jobs. They're out doing restaurant inspections and epidemiology reports and disease prevention work. If we get to a point where I need to have immediate capacity, I do have the ability to rope them in while I can rebuild some additional contract employees to manage the caseload.
How many contract employees do you have, and is that coming from the federal funds, or?
It is coming from the State Department of Health, ultimately through the federal government. You asked how many. I believe we are up to 17 contract employees, and then we've supplemented that with, we still have a few county employees working with us and a few volunteers, including some folks that are bilingual.
Thank you.
Absolutely.
Okay, we'll give it a second to see if any other questions come through. Not seeing any in the chat. All right, that appears to conclude our questions.
Okay, all right, very good. Once again, thanks to Greg Casterman and Tom Sinan for being here this morning. It's been a sobering morning. We are talking about losing people in this community, both to COVID-19 and to addiction. And so it's very sobering when you look at these numbers, you look at the maps, you understand the demographics of what's happening here. But thank you all for hanging in there with us, and we will be back next Wednesday.